This symposium is available on 3 social media platforms: Facebook, LinkedIn, and YouTube. If you have any question you would like to share with our speakers, please write them in the chat. And if for some reason you need to have access to translation, please connect to the YouTube channel and you choose appropriate subtitles. Good morning, good afternoon, or good evening, depending on where you are in the world. Welcome to this online event. My name is Olivier Exertier, working for the International Kidney Cancer Coalition. And I wish to thank you for joining us for this global symposium organized for World Kidney Cancer Day 2026. This year, we are focusing on emotional well-being for people living with kidney cancer. As you know, kidney cancer does not only affect the body, it can also affect how people feel, how they cope, how they relate to family and friends, and how they consider the future. Today, we want to open up that conversation and offer practical ways for patients, caregivers, and healthcare professionals to talk more openly about emotional well-being and fan support. Before presenting our speakers, I wish to thank IKCC board members Anne Wilson and Claudia Angarelli for leading the 2026 campaign, and all the IKCC partner organizations, patient advocates, and healthcare professionals who've supported and promoted this global awareness initiative. We will be joined by 3 globally recognized experts: Dr. Christiane Bergerot, Dr. Eric Jonasch, and Steve Pointon. Let me first introduce Dr. Christiane Bergerot. Dr. Bergerot is a psycho-oncologist with extensive experience supporting people affected by cancer. She is the head of the Department of Psycho-Oncology at Grupo Onconucleas in Brazil. She's been working with cancer patients for many years as a clinician and as a researcher. She has received a lot of grants on her work on the quality of life of patients with cancer. Christiane Bergerot is a member of the IKCC Medical Advisory Board, and she's been very involved in the preparation of this new edition of World Kidney Cancer Day. Dr. Eric Jonasch is professor of GU Medical Oncology at the University of Texas, MD Anderson Cancer Center, where he also serves as director of the VHL Clinical Center and the Kidney Cancer Research Consortium. With over 300 published research papers and over 30 years dedicated to kidney cancer, Dr. Jonasch has been at the forefront of advancing treatment options for patients, including leading the research that resulted in the first approved therapy for VHL disease. He also serves as vice chair of the National Comprehensive Cancer Network Kidney Cancer Guidelines in the US, helping to shape the standard of care for patients. Is extremely committed to improving outcome for patients worldwide. He's been actively contributing to IKCC activities since 2016. He first served as the chair of the IKCC Medical Advisory Board and is currently chair of the IKCC Board of Directors. Last but not least, Steve Pointon is a kidney cancer survivor, patient advocate, and counselor. After being diagnosed with kidney cancer in 2016 and again with metastatic disease in 2018, Steve became an active advocate for kidney cancer patients. He's been working with Action Kidney Cancer in the UK since 2019 and a board member with IKCC since 2024. As a person-centered counselor in England, Steve works closely with cancer patients daily, offering support and guidance. Finally, Steve has become a trusted voice in the cancer community as the host of the podcast Live With and Beyond Cancer, where he has reached thousands of listeners around the world. We are so grateful of you for sharing your expertise and perspectives. To set the scene, I would like to start by sharing a few figures. The findings of the 2025 IKCC Global Patient Survey, representing nearly 2,700 participants across 46 countries, highlight the critical role emotional well-being plays through the kidney cancer journey. 85% of patients reporting some impact on their emotional well-being as a result of living with kidney cancer. 50% of respondents reported disease-related anxiety, 49% reported fear of recurrence, and at least 1/3 experienced depression, fear of dying, or general anxiety. Those findings highlight the critical need to support patient emotional well-being throughout the kidney cancer journey. Experiencing emotional effects from a cancer diagnosis is frequent and normal, but there are ways for people to ask for help and for healthcare professional teams to address them. However, the Global Patient Survey revealed that many people are not talking with a doctor or any healthcare professional about their concern and challenges. Among those patients experiencing emotional impact, 32 to 52% of patients with fear of recurrent general anxiety, depression, or fear of dying do not speak with a healthcare team about those concerns. Those findings suggest that a substantial proportion of patients are facing significant emotional burden without seeking or receiving support from their healthcare providers. Today, we will look beyond the statistics to understand what those findings mean in real life for people living with kidney cancer. We'll discuss what patients, families, healthcare team, and patient organization can do to better support emotional well-being throughout the cancer journey. I would like to highlight the critical role of patient organization in complementing clinical care. By providing trusted information, practical resources, and opportunities for peer connection, patient organization can help address emotional needs that may otherwise go unmet. The Global Patient Survey shows that among patients who found patient organization useful, many would welcome greater access to emotional support, including counseling, in-person support groups, and online support groups. Those results demonstrate that both the need for and the value of expanding emotional support services within the kidney cancer community. We will cover during the symposium 4 main topics. The first one being about emotional well-being as part of kidney cancer care. We will then discuss kind anxiety, recurrence, fears, and uncertainty. The third topic will be about talking with family, friend, and care teams. And fourth, getting support and using the tool that we prepared for this event, the check-in tool. So let's start with the first topic. Emotional well-being challenges are common, valid, and part of the cancer care experience. They may include disease-related anxiety, scan anxiety, fear of recurrence, sadness or depression, fear of dying, uncertainty about the future, isolation, change in relationship, and difficulty coping with daily life, work, family or responsibility or family responsibilities. I would like first to give the floor to Christiane, and has the following question: why is emotional well-being an important part of cancer care, and why is it important that patients know their feelings are valid?
Hello, everyone. So it's a great pleasure to be here, and thank you so much for inviting me for this special talk. And also, thank you so much for your question. I would say that emotional well-being is an essential part of cancer care because cancer affects much more than the body. So it affects how people think, feel, relate to others, and even how they cope with the uncertainty around the diagnosis and also around the treatment. And we also know that emotional distress can influence quality of life, communications with healthcare team, and patients' ability to navigate their own treatment or even their own disease. And when we support emotional well-being, we are treating the whole person, not just the cancer. And perhaps most importantly, we help patients understand that feelings such as the ones that you have highlighted, anxiety, fear of cancer recurrence or progression, sadness or uncertainty, are common. It's a common part of the cancer experience, and it's valid and also deserve of attention. Thank you so much.
Thank you, Christian. Let's put you with Eric. Where do those concerns appear in clinical practice, even if patients do not always raise them directly?
Yeah, great question. And also wanted to thank you, Olivier, for chairing this, and my colleagues, Chris and Steve, for being here today. I think it's really a question of whether or not these anxieties prevent the patients from actually executing in how they're getting their care, how they're getting their scans, whether or not they're able to actually function as in the patient sort of care environment that they've been thrown into. And so I think we really need to listen very carefully to how our patients are coping, how they're whether they're able to actually get the things done that they're supposed to be done in terms of scans and labs. And sometimes also there are subtle signs that they may not talk about their emotional health, but they're going to talk about their physical health in ways that I think leads us to start asking questions about their emotional health. They may be ashamed or afraid to talk about their emotional health, but they'll talk about their physical health. That's one thing. The second thing also, I think, is that oftentimes patients will come with family members, and family members really want to let us know if the patient is struggling emotionally. And we have to be very attentive to the signals that the spouses and other loved ones are giving to us when we're in the room with them, because the patient may try to sort of downplay things. And we really need to pay attention to those family members to get some cues as to what's actually going on emotionally for these patients.
Thank you, Eric. Steve, what would you say to patients who feel they should just cope, or who worry that talking about emotional well-being means that they're weak or not coping well?
Hi, everybody, and happy World Kidney Cancer Day. Thank you, Olivier, for chairing and hosting this symposium. And thank you to Eric and Christian for being humble colleagues. I think that's a really important question, Olivier, and I would hope that society has changed over recent years around what they expect people to do around their emotional well-being and mental health. What would I say to people who think they should just cope? Why is the question I would probably ask. Is you're getting support for your physical health, but why would you not allow yourself the support for your emotional health? Because that ultimately allows you, as Christian and Erica said, to be able to concentrate on the things that you need to do to get through your treatment and to get through daily life as well, because life doesn't stop when you're going through treatment. You still have responsibilities. If you have family, you still have things you still have to survive. And ultimately, if we hold on to all this information, then what are we doing with it? It's just going to build and build and build. And then ultimately, at some point, we'll lose control. And I think it's really important that society changes too. And as I said before, I hope it has. But talking about emotional health and well-being is not weak. It's actually stronger than you would believe. To make yourself vulnerable and allow yourself to talk about things is actually strength, not weakness.
Thank you, Steve. Anxiety often clusters around scans, treatment decision, follow-up, might lead to fear of recurrence. So I would like to ask another question to Christian now. What practical strategy can help patients manage uncertainty? Thank you, Christian.
Yeah, I would say that uncertainty is one of the most challenging aspects of living with cancer, especially because many questions simply do not have answers. So, however, while we cannot eliminate uncertainty from these trajectory, we can definitely help our patients to better manage these emotional symptoms. So first, I would suggest, I would encourage patients to focus on what is within their control. For example, attending appointments, taking their own medications as prescribed, staying physically active when possible, and maintaining supportive relationship. And also talking about control, another important strategy will be to seek information from trusted resources. So I definitely encourage patients to discuss their disease status and treatment plan and possible outcomes with their healthcare team. I know that while these conversations may not eliminate uncertainty, but they often help patients to feel more informed and more prepared, and also more in control of the aspects of their care that can be addressed. On the other hand, I would suggest relaxations, strategies such as mindfulness. We have seen a lot of benefit with these interventions for our patients with kidney cancer. Also, the breathing exercise, or even physical activity or exercise, journaling, or even engage in meaningful activities. All of these resources are really something that it's close to our patients, so they can definitely use in their favor in order to find a balance between their own emotions. And finally, sharing fears with healthcare professionals, with their family members, or even support groups or counselors. This is truly a key strategies, and often makes the burden feel a little bit lighter and help them to feel less alone on this trajectory.
Thank you, Christian. Steve, I said already, you work every day with cancer patients as a counselor. What do those patients tell you about waiting, about uncertainty?
Yeah, I think it's my wider role as a patient advocate and as a patient experiencing it myself as well that can help me answer this. And I'm going to sort of build on what Chris has just said, really. It's fear, and there's a lot of emotions that are behind that, and it can become debilitating for patients when they are overcome by fear, because fear of the unknown, ultimately, if we're talking about scans specifically, ultimately we hear a lot of people say to them when you're going for a scan, for example, everything will be okay. Don't worry, everything will be fine. Well, how do you know? Because with the greatest respect, Eric doesn't know that somebody's scan is going to be okay until he reads that scan. Nobody knows. So if we can work with that fear and not dismiss it and all the emotions that are there, we can then concentrate on something that Chris was just saying about being in control of what we can control. We can turn up for the scan. We can do what we need to do to get through each day until it comes to that point when the scan results are given. And it's important not to dismiss that emotion, though, because that emotion's telling us something. And the way I try and work with people is to take control of that emotion, because emotions only have intimidation over us. And ultimately, we can cut the fuse to that intimidation. And yeah, patients tell me it's debilitating, it's frightening, it's scary, but there are ways through it.
Thank you, Steve. Eric, we would like to hear your vision as a doctor, and please let us know how clinicians can talk about uncertainty in a supportive way.
Yeah, I think a couple of things, and before we talk about dealing with uncertainty, I think it's also a question of helping to decrease the amount of uncertainty that patients have to cope with, and also create workflows that allow the patients to not have to experience as much anxiety. First of all, the time interval between when the scan is done and the patient speaks with the doctor, I'm told, is the worst part. So trying to reduce the number of days or hours between when the scan is done and the patient speaks with the treatment care team, I think is really, really important. And if that's in any way possible, that's something that can be implemented. I try to get patients to get their scans the night before and speak with them the morning after, so that the time interval that they're waiting for the results is less than 24 hours. If that's at all possible, I think that makes a huge difference. The second thing really is, I think, talking about what outcomes can be, and this is kind of part of a conversation that we have on an ongoing basis. You know, if scans show a certain thing, we would end up doing these things. And if the scans show another thing, we would do those things. So basically already having the conversation before the scans are done about what we would end up doing with the information were we to have a more favorable or less favorable outcome, I think also helps demystify the whole situation. And also, I think the scans themselves, you know, you see the reports, there's a lot of words on the page there, making sure that you go through the information, because there are things that we as physicians or healthcare providers find, you know, are not worrisome at all, because we know that these words mean something not too troublesome. The patients, you tell them, hey, everything looks good. They go home, they read the report, and they see a lot of different phrases that frighten them. Making sure that we get ahead of that to make sure that those surprises don't occur after the fact is really important. So I think it's providing information in a timely manner, preempting and getting an idea of what the plan would be were there to be a favorable or a less favorable outcome or a change in the scans, I think really helps with coping.
Thank you very much, Eric, for sharing your comprehensive experience. Talking about emotional well-being can be difficult, but it is sometimes the first step to getting support. Christiane, please tell us your view on how can patients start a conversation about emotional well-being.
Awesome. So I would suggest to be as simple as saying, for example, I've been feeling more anxious lately, or I'm struggling with fear about future. It's important to highlight that patients do not need to have the perfect words, and also to highlight that the emotional concerns are really important and should be discussed during the medical visit. Please don't worry about taking up too much time to share a little bit more about what you're feeling with your treating physician, because understanding how a patient is coping emotionally is really an important part of providing high quality cancer care. And I often encourage people to prepare before appointments by writing down their concerns or even rating how they have been feeling over the past week or so. These can really make easier to communicate with the healthcare team what they are really experiencing, and also help to prioritize what matters to them and what they have faced over the past week or 15 or 2 weeks. And when talking with family and friends, honestly, is really important. So sometimes saying, I need someone to listen to me, or even I'm having a difficult day emotionally, or it's enough to start like a conversation. I also encourage to be clear about what you need. For example, if you want some advice, or if you want some practical help, or really, or simply a listening ear. So being specific can really make this conversation much easier and helps avoid frustrations or even misunderstanding.
Thank you, Christiane. To follow up on those recommendations, Eric, would you like to tell us what healthcare team can do to make those concerns easier to raise?
I think it's listening, open-ended questions, watching for signs. You know, we have a couple of tools that are being implemented in our healthcare system, where questionnaires are distributed to patients asking about distress. If your institution does have those instruments, take a look at them, and this will allow you then to start asking open-ended questions about emotional health and emotional well-being. As I mentioned before, listening to family members and making sure we really pay attention to the family members' cues. At the end of the day, if the family member says, I'm very worried about my loved one's emotional health, and the patient will then say, no, I don't want to discuss this, it's not something we can talk about that day, but it is something that I think we need to flag. So I think it's this looking for the cues, open-ended communication and open-ended questions where the patient will be allowed to make these comments, and listening to family members.
Thank you, Eric, for highlighting those important elements. Steve, according to you, how can peer support and patient organization help reduce isolation of a kidney cancer patient?
Yeah, I'll try and take that in two folds, Eric. Olivier, if that's okay. Peer support, I think, is the most valuable support for patients out there in terms of emotional well-being, because we can get all the information we need that's going to help us with our treatment and our health from people like Eric and our oncologists or our consultants. But the people who know what it's like when we're struck by that fear we were talking about before and that uncertainty, people who get it are people who've been through it themselves. They know what it feels like to have certain medication. They know what it's like to have certain operations. They can give us the tips of what do we need for our hospital stay? What could we need for our journeys home? What do we need to rebuild our lives? What helps other people? That can make you feel so supported even by just listening to other people. And in terms of charities and patient organizations, I can talk from an Action Kidney Cancer point of view, is we have so much information on our websites. And Chris mentioned before about don't worry about time. But we know as individuals, medical professionals are busy people, and they may not be able to give us all the information we have. We might not have prepared all the questions, and we might think about something afterwards. But I know on our website we have such a wealth of information, fact sheets, help sheets, even things like, what do I do about travel insurance? What do I do about life insurance? Can I get that anymore? What's the difference between kidney cancer and kidney disease? We've got all of those sorts of information leaflets and things available on our website, and you can read them at your own leisure and in your own time. So yes, as a counsellor, I would always promote counselling, but I actually think peer support is so beneficial to cancer patients.
Thank you, Steve. I would like to carry on the discussion now on the importance of getting support. Support for a cancer patient can come in many ways, including clinical teams, psycho-oncologists, counseling, peer support, patient organization, family and friends. And I would like to highlight here the role of those caregivers. The important message is that people do not have to manage emotional well-being challenges alone, and simple tools can help them start the conversation. Eric, I would like to address you the first question. Patients may not always raise emotional concern during appointments. What can clinicians do to recognize when someone may be struggling and help them access support? Thank you.
Yeah, great question. And one of the things is that people may not want to talk about their emotional problems, but there are things there are cues. For example, we do a review of systems on our patients and ask them, how are they sleeping? And if their sleep is very interrupted, this then leads to the question of why is the sleep interrupted? So I think looking at what I would call somatic findings that really give us clues, weight change, appetite change, various other things that are not necessarily directly related to their emotions, but are directly tied to their emotions. But I think we, again, have to be very sensitive to make sure we get an idea of what the overall sense of well-being is of that individual, and to determine how much of those things might be driven by psychological stress. And if those things do arise, asking in a very open-minded and open-ended way whether or not they would like to have some sort of support, whether it be peer support, whether it be professional support through psychologists, or whether, for example, the somatic things like sleeplessness and that need to be managed pharmacologically.
Thank you, Eric. The next question would be for you, Chris. Many people may wonder whether what they're feeling is normal, is it part of living with cancer, whether they need extra support. What sign should patient or caregiver look out for? Or what kind of support can help? Thanks.
Awesome. Great question. Yeah, some signs include persistent sadness, anxiety that interferes with daily activities, or difficulties in sleeping, as Eric has mentioned, or even loss of interest in things that were once enjoyable, feeling overwhelmed most days, withdrawing from family and friends, or even feeling unable to cope with all these uncertainties that we were talking about. And when I say persistent, I mean symptoms that are present most days for at least 2 weeks and are really affecting a person's daily functioning, relationship, or even their overall quality of life. These are definitely signs that additional support may be beneficial. And I would say that caregivers may sometimes notice change before patients recognize themselves. So for this reason, when appropriate, caregivers can gently encourage conversations with the patient and the healthcare team in order to find some support. And this support can take many forms. For some people, a conversation with their healthcare team and additional information about their own situation may be enough. For other patients, may benefit from psycho-oncology service, or even the counseling or support groups or peer mentoring, patient organizations, or even psychiatric care when needed. But the most important message here is that no one should feel they have to manage these challenges alone. Help is available, and seeking support is really a sign of strength and not weakness.
Thank you, Chris. Steve, the last question will be for you. As part of World Kidney Cancer Day 2026, we've been developing well-being check-in under the leadership of Christiane Bergerot. It is available online. And Steve, could you please tell us how can this emotional well-being check-in help patients prepare for conversation with a healthcare team, family, or friends?
I think it's a valuable piece of information, or kit, if you like, a tool. I think sometimes, yes, relatives or caregivers may notice a change in us, or we may notice it in ourselves as patients. But sometimes when we receive a diagnosis and go into treatment, we can almost go into survival mode and we don't notice what's going on around us. And those closest to us, if we have people closest to us, that is, of course, some people go through this alone, may not recognize the changes in us. And the wellbeing tool that's been produced can act as a prompt for us to check in with ourselves as patients about where we are. So who do I talk to about kidney cancer affecting me emotionally? So that forces you to think about, who can I talk to? Who do I have around me? Do I have a partner or a relative or a friend or healthcare team? Who have I got? What do I do if I worry about scans? Do I always worry about scans, or is there a particular time that makes me worry about them? As Eric said before, how's my sleep? Am I sleeping well? So am I going to an appointment with my oncologist? Am I going to mention that I'm not sleeping well just in case they don't ask? Because that could be, as Eric pointed out, it could be an emotional factor. It could be something to do with my treatment, but let's get it out there and talk about it. am I doing enough physical activity? Am I capable of doing that physical activity? It as I said at the start of my answer, it gives us that prompt and makes us think about it, because we are in survival mode and doing mode. Often a lot of that information doesn't come into our radar or thought process. We're just getting on and doing what we need to do.
Thank you, Steve. We are reaching time now to wrap up this discussion. And to conclude, I would like to ask each of our three great speakers if you could please share one practical action you would like patient, caregivers, or healthcare professional to take after watching this symposium. Would you like to start, Chris? Thank you.
Sure. So my practical actions will be simple. Ask one question about emotional well-being. And for patients, tell your healthcare team how you have really been feeling. For caregivers, ask your loved one how they're coping emotionally. And for healthcare professional, to routinely check in on emotional well-being during appointment, as Eric has suggested. And sometimes a single question can start an important conversations and open the door to support that makes a meaningful difference in someone's cancer journey.
Thank you very much.
Thank you.
Chris. Eric, would you like to share your recommendation? Thank you.
I think first of all, we have to think about how can we make our healthcare experience for our patients as unstressful as possible. As I mentioned before, creating the environment where anxiety is reduced, where we can help anticipate outcomes and talk about them before they happen, and make sure that the communication between the patient and the team and also the family members is very fluent, I think is critical to make sure that we support the emotional health of our patients.
Thank you, Eric. Steve, would you like to conclude this wrap-up session?
Very similar to what's already been said, though, but I would add, please don't be afraid to talk about emotional well-being. A lot of people are frightened of what answers might come back. So if I was, as a patient, to tell my oncologist that I'm struggling emotionally, does that mean I'm going to have to stop treatment because I'm not coping with it? It doesn't mean that at all. It means there might be another way for somebody to help. And as a caregiver, I ask you as caregivers to ask your the patient, how are they doing emotionally? And then when they get an answer, ask them again, because you're more likely to get a more honest answer if you ask them a second time, because as patients, we recognize caregivers are going through this too, and we want to protect them. So ask them twice. And again, as healthcare professionals, similar really, allow the opportunity to discuss people's emotions. It's not just how's the treatment going, how are you feeling, what are the side effects. There are so many other things that go towards a patient getting through this treatment.
Thank you so much, Steve. Thank you so much to our three speakers, Chris, Steve, and Eric, for sharing your insight, those practical advice, which are extremely precious for the whole IKCC community. This symposium is not over because we would like to recognize several outstanding contributions from across the global kidney cancer community. And therefore, I'm delighted to invite Dr. Eric Jonas as chair of the IKCC Board of Directors to announce the 2026 IKCC Award recipient. Eric, please.
Thank you, Olivier. Yeah, I am very pleased to announce the recipients of several awards at this point in time. First, I'm going to start off with the 2026 IKCC Seed and Grow Fund. And this program provides 2 grants of €1,000 each to support innovative kidney cancer awareness, education, advocacy, and support initiatives for low and middle income countries. This year's recipients are V-Care Foundation in India and the Feliciana Mashanga Memorial Center Foundation in Tanzania. VCare Foundation in India has been awarded a grant for the Miles That Matter project, which aims to increase kidney cancer awareness in underserved communities through education, community outreach, and partnerships with local healthcare providers. The Feliciana Mshanga Memorial Cancer Foundation in Tanzania has been awarded a grant for its Strong Kidney, Strong Hope project, which combines kidney cancer awareness with emotional well-being and psychological support for patients and families affected by kidney cancer. I'm also pleased to announce that due to the high standard of applications received, we have joint recipients of the 2026 Cecil and Ken Yauner IKCC Scholarship, which recognizes and supports medical students and early career physicians pursuing careers in kidney cancer. This year's recipients are Dr. Paula Ines Valdez Sandoval from Mexico for her work on sex-based analysis of intermediate poor-risk patients with papillary, chromophobe, or unclassified histology, and Dr. Zuhair Mashid, USA, for his work driven by a code-to-clinic philosophy focused on bridging the gap between complex data and bedside decision-making. Finally, we have joint recipients of the inaugural IKCC Allied Healthcare Professional Scholarship Award, which recognizes allied healthcare professionals whose work significantly enhances the care experience and quality of the life of kidney cancer patients. This year's recipients are Dr. Helen Garcia Llano from Spain for her contribution to the empowerment of patients with kidney cancer and the development of patient-centered initiatives, and Omobemini Ojole from Nigeria for her work strengthening cancer care through patient navigation and the establishment of a satellite phlebotomy station at the National Hospital Ajuba. All 4 scholarship recipients will receive a travel grant to attend the IKCC Global Kidney Cancer Summit in Prague, where they will present their work and share their experience with the international kidney cancer community.
Thank you, Eric, and congratulations to all of our award recipients. As we come to the end of today's symposium, we would like to thank first our panelists, Dr. Christiane Bergerot, Dr. Eric Jonas, Steve Pointon, for sharing their time, their expertise, and perspective with us. We would like also to thank our World Kidney Cancer Day sponsors, Arcus Bioscience, Aveo Oncology, Ipsen, Merck, and Roche. Their support helps make awareness campaign such as this one possible, and we are very grateful for their contribution. Finally, thank you to everyone for joining us today. Emotional well-being is a real and important part of living with kidney cancer. We hope today's discussion helps more people feel able to talk about what they're experiencing and ask for support if they need it. Please visit the World Kidney Cancer Day website. There's a lot of resources that you can download, including the Emotional Wellbeing Check-In. You can access campaign resource, share the campaign with your community. Thank you so much.